We will now go to Chile. Marcelo from Chile, El Pingüino newspaper. Can you hear us, Marcelo?
Hi, hello, how are you? Can you hear me?
Yes, we are all very well. Please go ahead, Marcelo.
Thank you so much. Good morning, doctor. In Chile, there is several cities in quarantine. Many will be 20 days old. My question is it recommendable to keep this measure thinking about the population mental health?
Thank you. If I understand your question, you said, is it okay to keep these measures while considering people's mental health? And that's an important consideration. There is no doubt that restrictive measures, stay-at-home orders, restriction of movement has been quite isolating for people, and all the more isolating for people who are already isolated or vulnerable. And therefore, as we have always said, lockdowns in their own right are not a solution, but they have, those population-wide physical distancing measures have proved quite effective in countries where there has been a rapid escalation of cases, sometimes as a result of not being successful in containing the disease in the first place. Those measures have served to suppress some of the transmission. We have said in our strategy that was released yesterday, and we'll be releasing further technical guidance later today, tomorrow, on the transition strategies that countries have. We do note that in Chile and in other countries in South America, there's been an acceleration in infections, and it did require measures such as that. But those measures need to be replaced with strong public health intervention, case finding, testing, contact tracing, quarantine, community engagement, and in some ways a new norm where communities, all of us, are going to have to adapt to new ways of behaviour, new ways of interacting with each other while we continue to suppress the virus and while we search for a vaccine and therapeutics that will help us to truly suppress both the number of cases and the mortality associated with this virus. Mental health, we have issued guidance on mental health and how to manage mental health. It's been one of the big issues, as you've seen in social media. There's a huge outpouring of support for people. I think communities are supporting each other. There's been an incredible outpouring of solidarity between people. And while we may be physically isolated, I actually have seen amazing stories of us not being socially isolated. It is tough, it's not easy, and it's something we must endure, and we must endure it until we have in place the other measures to suppress this disease. So we've said it very clearly to governments. We must work really hard now to accelerate the investments we need in public health infrastructure, in community engagement and education, and having a hospital system capable of dealing with cases. If we do that, we will be able to make our way out of these more draconian lockdowns, and this is something that the World Health Organization wants so badly with the rest of the world.
Yes, thank you. So as you've heard us say, we've stopped saying social distancing. We've been saying physical distancing because it's important to remain physically separate but socially connected. And there's a lot of ways that you can look after your own mental health and the mental health of your family during these very difficult times, whether you are adhering to a stay-at-home order or you are isolated yourself. There's a lot of things that you can do. There's no lockdown on laughter. There's no lockdown on talking to your family and finding ways to connect, and especially through different religious periods that are coming up. There's ways in which you can connect with family using technology that you may not have used previously. Make sure you exercise any way that you can, whether it's at home and doing a class, whether it's doing yoga, something to keep yourself physically active. Make sure if you meditate, find ways to meditate or find ways to turn the news off, and have some time for yourself. Listen to some music, read a story, play with your kids. Just find ways in which you can remain socially connected with others while you're remaining physically apart.